In terms of the national context of the organisation, what we were looking to do was try to release time for staff and optimise the patient experience, but make sure that was fully aligned to the national plan. The state of play in the organisation before we looked into working with Intouch, we had several issues. I think we had very limited control and quite archaic processes in place for patient appointments. There was limited language support, so it was difficult for some of our patients with various language requirements to be met by one receptionist. I think the pressure on the receptionist was also excessive. The organisation didn't feel as though we were providing a quality service, a patient-focused service, being recognised as being suboptimal. We were enthused really to work with Intouch to embark on IT implementation of a system that can address those issues and smooth the flow and optimise the experience of the patient.
Before we had the kiosk, when patients were booking in, we'd have a queue outside the door.
A lot of our patients prefer using the self-check-in. This prevents them from standing in long queues.
You've got two choices. You've got to book in at the reception and you've got to book in at the kiosk. But you find a lot of people book in at the kiosk and then just come in and sit down in the waiting area.
It wasn't about removing posts, it was about releasing their time to do more constructive activities.
The girls have enough to do in reception because they're answering phones and they're seeing to us when we're coming in for notes. So it takes a lot of pressure off the reception staff and it's a lot easier booking in on their kiosk.
We have in the region of 90% of the patients arriving in outpatients self-check-in now. In order to give patients a choice as well, we still have a receptionist because some people still want that one-to-one dialogue. That's absolutely fine for the 10% who choose to do that. The patient is at the centre of all of the Trust's innovations. If it doesn't benefit the patient, then the Trust would not embark on it. So in terms of patient experience, quality and safety, I think the main benefit was empowerment of the patients, giving them control over their appointments, giving them a more sensitive, individualised experience.
Since the call screens have been introduced onto clinic, it helps the nurses manage patient flow. We can see what patients have actually had their appointment, and it also displays waiting times on the screen. This gives the patient an idea of how long they're likely to wait. It also reduces tension on the clinic, and this in turn frees the nurses up to interact with the patients and do any other treatments that the patients may need.
It's very helpful for the patients because it directs them what room to go in.
It is really easy for patients and the doctors and nurses.
It helps us as well because when we're doing different tasks, we haven't got to keep running in and out and explaining to the patient why our clinic's behind. So it's all on the screen in front of them, updated.
We have also achieved savings over £250,000 in the first year, and that's recurrent savings, and they've been achieved by optimising flow, improving quality, safety, productivity without removing staff. So overall it's been, I think, an exemplar of smooth and flow for the benefit of the patient, with the patient at the centre. Intouch alleviated and smoothed a lot of our anxieties about implementation of technology, and actually helped us to do the project. Importantly for me, they didn't just come in with the product and then leave. They stayed with us, they were flexible, they were responsive to the needs of the organisation and the patients. It was extremely refreshing that Intouch were comfortable in demonstrable hard measures as well. So saving cash, hard measures of throughput, turnaround times in outpatients, the numbers of patients going through. So some of these hard demonstrable dashboard measures, some companies are quite nervous about because you either do them or you don't. And Intouch were confident in their products and their abilities to sign up with the Trust to being able to provide that assurance of value for money on a continuing basis.